When it comes to exploring the community around you, you can't help but think of the people it consists of. More importantly, how our neighbors are helping one another. I visited Rochester's Minnesota Adult and Teen Center to see how they're lending a helping hand to people struggling with addiction.
We have full-time staff, similar to like a hospital setting.
The Minnesota Adult and Teen Challenge of Rochester works to help its clients overcome unhealthy strongholds by addressing their physical, emotional, and spiritual needs. When clients walk through the massive facility's doors, they receive a comprehensive assessment to observe their substance abuse and how it's impacted different areas of their well-being. Jordan Jacobson, a client manager of the center, speaks on the need of this attention.
In Rochester, especially because it is, a med-based city, there's so much going on in like the opioid epidemic still, right? So we actually have a high number of clients coming to us who are addicted to pain medications. Their addiction spiraled and they're using illegal substances.
The good news, according to the Department of Health, is that the total number of opioid prescriptions has been decreasing among Olmsted County residents since 2016. But that doesn't mean the impact doesn't exist. And while those numbers have gone down, Minnesota as a whole ranked number 9 out of the 13 states with the highest alcohol sales during the COVID pandemic. Part of the reason being because it's legal and easily accessible. Another reason?
People who may not even have been in that serious of an addiction, when they were isolated at home, depression kicks in, anxiety, fear, all those things, they turn to alcohol.
I was very broken. Emotionally, spiritually, mentally, I was at an all-time low.
Jeremiah DeRushia is a Minnesota Adult and Teen graduate. He now works with the center as a maintenance intern as a way to give back and help others.
I had my first drink when I was 13 years old. I was introduced to opiates at 14 years old. And by 15 in high school, that's when it became, I think, really experimental.
He joined the program where he was able to work with people like Sue Ude, a clinical supervisor, and he's now been clean for nearly 16 months.
In primary group settings where they get a little deeper and they start to process and the issues that have kept them going back to using.
I think actually the more difficult part is the application. So there's understanding, how did I get here? What are the things that attributed to becoming addicted?
That application comes with getting back into a healthy exercise routine with the center's gym and creating a space that allows clients to feel free. And after nearly a year in the program, many like Jeremiah earn a sense of peace and certificate of graduation. What would you say was maybe the struggle point for you here?
Being not isolating, getting back into being confident that I can be around everybody and that I'm just like everybody else.
The next step is aftercare with people like Leon Nelson and former graduates of the program, where clients are prepped for employment, school, and other resources.
If we can get that done and they commit to all those items, we're confident in their ability to be sober.
And if at first the client doesn't succeed, Hunter says he encourages those struggling to remember the center keeps its doors and its arms open. Once they graduate, the Minnesota Adult and Center say they do a step-down approach with the services to ease their graduates back into independence.